Welcome to another blog with the Cohen review. I am Miss Cohen, and today we're going to go over COPD versus asthma treatments. What are the differences? This question has been brought up quite often by my students, and I want to make sure to make it as clear as possible so you ace board exams. But before we begin talking about all these drug names, you have to understand the pathophysiology of each condition, because if you understand what is happening on the illness, you'll know how to fix it or make it better. So let's start with the pathophysiology. COPD is a chronic, long-term inflammatory disease that is characterized by that irreversible, and that's the key word, irreversible airflow limitation, primarily caused by environmental exposures like smoking. These people have smoked all their life. They've caused damage to the lining of the bronchioles, and it's caused that damage. Asthma is reversible. Reversible airway disease. We can make it better. We can make it go away. And this is marked by inflammation, hyperresponsiveness of the bronchioles, and that episodic bronchoconstriction that is often triggered by allergens or irritants. The lungs are freaking out. They get tight and you can't breathe well, but it's reversible. Now let's dive into the treatment approaches for COPD and asthma. COPD treatments will focus on opening things up, bronchodilators, such as your LABAs, your SABAs. And we like to use the LAMAs because they dry the schmutz. Asthma, on the other hand, emphasizes on the steroid use and the bronchodilators because we like to calm things down and we like to open things up. So we want to reduce that inflammation to prevent an exacerbation. Now let's review some of the most common medications used for COPD and asthma. But before we do this, please know you don't have to memorize all the drug names. Instead, look at the suffix or the ending of the drug names so you can figure out which category they fall under. What do I mean by this? SABA. The only SABA you should know for purposes of the exam is your Albuterol. And I'm going to exaggerate the pronunciation to make it easier for my teaching, but Albuterol, terol. If you get another drug name that ends with terol and is not Albuterol, guess what? It's going to be a LABA. Salmeterol, Formoterol. As for your steroids, they end with "-one", like prednisone, Fluticasone. They may also end with "-ide", like your Budesonide. And as for your LAMAs, that's an easy one. They end with ipium, like your Tiotropium. So now when you look at a drug name, even if you've never seen that drug name before, you can look at the suffix and you know what it does, where you can use it, what you can use it for. So for example, Albuterol, Albuterol, SABA, we use it for both asthma and COPD. Salmeterol, terol is your LABA. We use it for both. Fluticasone, OWN, we really like it for the asthma, but we can also use it for COPD. Tiotropium, ipium is your LAMA. We really like it for COPD. Formoterol, it's a LABA. We use it for both. Budesonide, ide, it's a steroid. We really like it for asthma. And just like that, look at the suffix of the drug names and you'll figure out what to use it for. Let's further explore the mechanism of action of each medication class. Your beta agonists, your Albuterol, they increase that dilation, bronchodilation. Your steroids, on the other hand, calm things down. They reduce the inflammation in the airway, hyperresponsiveness. And your LAMAs, they dry the schmutz. So now that you understand these mechanisms, you're able to figure out what to use next on your patients. So on the exam, they'll provide you a scenario. You most likely need to add something else. So now by paying attention to what they've done so far, you know, and you'll figure out what to give them next. Because unfortunately, it's not a one way for everybody. Everybody will respond differently to these medications. So here are the key takeaways. COPD treatments focus on bronchodilations and drying things up, while asthma treatments emphasize on the steroid use, the corticosteroids, and the bronchodilators. Now you understand the pathophysiology and the treatment approaches for each condition. And now you can use that comparison chart that I provided in the blog for your treatment decisions to better guide you. In conclusion, understanding the differences between COPD and asthma treatments is crucial, not only for providing effective care, but also for passing nurse practitioner board exams. I hope that this video has helped you grasp these key concepts. Don't forget to check out our comprehensive study materials and courses on the Cohen Review website to help you prepare past board exams. Thank you for watching.